Last week, I spoke with Secretary of Veterans Affairs, Robert Wilkie, as the president announced the next steps in the Prevents program and the task force, a focus on PTS, a focus on veteran suicides, and an expansion as well in various aspects, help for caregivers of elderly veterans. There's a lot to this. The president going to the next steps because as we develop the information, as we learn more about this, more and more, this is a combined effort of not only the Veterans Administration, and given the challenges in coronavirus or during the coronavirus pandemic, but also that there are many private organizations out there that are able to reach out and help. Earlier, I talked to Kathy Costello. She's in Oklahoma. The project I'm working on has a facility in Tulsa, Oklahoma, and of course, their major focus will again be on helping veterans. But to the point of many stepping into this, it is not a new fight for many organizations, but it is an important fight. Ryan Manion, president of the Manion Foundation, joining me now. Again, Ryan, just great efforts of partnerships to solve these rising rates when it comes to veteran suicide, or certainly not declining enough when you look at it.
Absolutely. Thanks so much for having me on. And I think that you kind of hit the nail on the head. This is not just a issue that is reserved for our veteran community, but our nation as a whole. You know, the second leading cause of death for those under the age of 35 is suicide. So when we look at that, I think this whole Prevents initiative is great because it does address the mental health issues that afflict our veterans, but more than that, we can start to take away the stigma behind mental health for our nation as a whole, for those that are suffering, and for those that need to seek help.
What are you doing? What are you doing at the foundation in various ways I know that you do to help, but what are you doing?
So our organization is, we began in 2007 after my brother, First Lieutenant Travis Manion, was killed in Iraq. And our goal is simple. It is to empower veterans and families of the fallen to strengthen communities. But the way we do that is by making sure that when veterans take off the uniform, they are still given an opportunity to serve. And I think that we can't forget the importance of what it means to feel disconnected. You know, 55% of our veterans are taking off their uniform and they're saying they just don't feel connected to their communities, and they're feeling isolated. They're feeling a lot of the things that our nation is feeling right now during COVID. And so we make sure that we provide that holistic approach to say, hey, you've taken off the uniform, but we're going to give you opportunities to get back out there to show that you are civic assets. And so they'll do everything from beautification projects in their own communities and towns across the country to we even have thousands of veterans that are out there that are teaching character to our next generation. And in doing so, they're finding a renewed sense of purpose themselves.
What's the importance of multiple organizations stepping into it from your perspective?
I think it's huge. And I think, you know, for us, we consider ourselves one of the organizations that comes in it that's preventative. So we are not the organization that you come to when you're in a mental health crisis and you've got to pick up that suicide hotline. We're the organization that you come to, and we help from a preventative standpoint. And if you have that flow of groups like us that are working with veterans immediately as they're leaving service, all the way to the VA where they're able to find crisis support, it creates this continuum of care that needs to happen in order to address something like this.
The point you just made, and you know, when I think about this, there are different types of organizations at different points. You look at a Companions for Heroes that was founded by David Sharp, for example. You know, at different points, early, preventative, treatment, post, continuum of care, an important part of this. Continuum of care was something that began in the Pentagon and largely in modern form under Linda Davis when she was Undersecretary of the Army, and she's now at the VA. So we're seeing the people who actually have the experience in care components and real world rather than just glossing over the problem. Are there missing parts of this? Are there other parts that really need more attention?
I don't know that there's missing parts, but I think it's taking those parts and putting them together, because I will say one of the biggest things I find is that veterans don't necessarily know where to turn. So I think an initiative like this, where it becomes as simple, they're looking at it from a public approach where it becomes an awareness campaign. And I don't think there's been an awareness campaign this strongly for veteran suicide ever. And so when you look at other awareness campaigns like Don't Drink and Drive and ones that are just so recognizable to us right now, to have something that all of a sudden it's like, okay, this is the campaign, and now I can figure out where I need to go to find help. I think that's the biggest challenge, is there are so many organizations, corporations, the government, there's so many avenues to take, but it's kind of dissecting that roadmap and saying, okay, where do I actually go? And I think if we make it more of a mainstream initiative, that becomes easier for veterans and anyone, frankly, to access.
Well, what are some of the next steps you would like to see come out of this effort? And it's a renewed effort, and it's a next step in this Prevents program and the task force out of the VA and this partnership with private organizations. But, we've got to move quickly, because part of this is for years we heard it's an issue, but action wasn't taken. Now we're seeing more and more action being taken. Suicide it's a moment-to-moment issue for some out there.
Absolutely. I mean, I will say for me, given the organization I lead, that's always been really important to us, and we've always recognized that preventative approach. And I will say that it is just as of late, in the last couple of years, that the VA has recognized this holistic public health approach, and that's huge. And that starts to put groups like us on the radar as a solution to a bigger problem. And so just in that, I think we've made huge headway in being able to form a consortium of organizations that can play a really big role in what comes next. And, I think that they've acted pretty quickly. I will say, this just came about in the last year, this Prevents Task Force. We've been a part of it from the beginning. We've attended all the meetings at the White House, and I'm actually thrilled at the advanced pace that they've taken this, that they've rolled this out. And now it's about, really rolling it out in a big way and making sure that all the pieces are in place and that people understand how it all works. So I think the next biggest step is the communication of how the plan is laid out.
Yeah, and it is a plan, as I know and as you know, that is in constant development and, in very almost military fashion. It has to adapt as things develop and as things change. And certainly I think it's changing for the better, Ryan. Thanks for joining me this morning. You do great work. The website, by the way, travismanion.org. But Ryan, keep it up.
Thanks so much.